right, students, we're going to finish this unit. This is chapter 7. It's a nuts and bolts chapter. And it's one that, again, because of the safety issue with it, is heavily tested on the NBLEX exam. And so let's get going. So here we go. We just finished indications and contraindications, and we're now into hygiene, sanitation, and safety. Okay. So the first part is going to be about you. So smoking, we all know, I mean, I know people smoke, I'm not, but we all know that there are consequences for some of these kinds of behaviors. So there you go. The issue in the massage therapy realm is for smoking, carrying that smoke smell in on your clothes. And for alcohol and drugs is impaired judgment. And hygiene can be a big player on whether or not you have retention. If you smell different or if you smell offensive, if you've got body odor or breath odor, or in addition to this, you don't use any kinds of perfumes or essential oils or any of that. You need to not smell at all. So these, not only can this be detrimental to your own health, it's going to interfere with your ability to have client retention. We all lived through the pandemic, so we get it. We get this sanitation thing. And then here are the contagious conditions that are transmittable, that we are trying to eliminate, which is probably impossible. We're trying to contain the spread, and we do that through protective equipment, PPE. We do that through sanitation and disinfection and staying away from each other, which is a little hard when you're a massage therapist. And so that's what this is going to be talking about. Also, fire and premise safety. And this segment here, workplace violence, sexual harassment, and vulnerability to sexual harassment. This is important. It may not be tested as heavily on the NBLEX exam as this stuff, but it's important for you to maintain a safe environment for you as well as your clients. So chapter objectives, you should be able, at the end of studying this chapter, be able to have a conversation about these things. If I were to sit down with you and say, what standard precautions and how are you implementing that? We should be able to have a conversation about that. You should recognize the baseline terminology. And here is that baseline terminology. Remember, you can go to the glossary and look these words up, and you can also put them into the search program, and it'll search not just in this chapter, but throughout the book. Here's our overview, and the go-to agency to stay updated is the CDC, Centers for Disease Control, and you really should be checking that monthly. So the proficiency exercise is taking you out to these resources for you. CDC, Medline Plus, which is a source of information, and then the American Red Cross. And the other safety issue everybody should have is first responder, first aid, and the defibrillator, and the cardiac intervention. The name is escaping me at the moment, but that all happens at the Red Cross. There are other agencies, but the Red Cross, CPR, I knew I'd remember it. All right, so we don't offer that, but every citizen should have that. So make sure that you are current with that. Okay, so we're going to start with you. And I already gave a little bit of overview on that. I strongly suggest you wear a uniform, a professional uniform. Not everybody agrees with me on that. And I also strongly suggest you wear a rubber-soled closed shoe, like an athletic shoe. This will help with the ergonomics and the biomechanics. All right. This little piece right here talks to you about the sanitation issues with jewelry and piercings, even eyeglasses. So not tattoos. The issue in the past with body art had more to do with how you were presenting to the public, and people are judgmental. And because people are, they would make a determination about your skills as a massage therapist in relationship to your body art. That has changed. But if you have jewelry on, take it off in the professional setting. It's just not worth the safety hazard with it. All right, here is our sanitation. I'm doing this one in the morning, so I have my tea concoction. This is not an option. You just do this. And it's very well described in the textbook. So this can change. That's why you need to stay up to date with the CDC. And this really was brought to the forefront to the general public, to all of us during the pandemic. So these are the organisms we're going to battle with: viruses, bacteria, fungi, protozoa, and pathogenic animals. And, it's a hard war on this. So it's something we just have to keep up with all of the time. There are treatments should somebody be infected with one of these. We have antivirals and vaccine that's preventative for virus. We have antibiotics, and that's problematic because a lot of the antibiotics we have are now smarter. The bacteria are smarter than our antibiotics, so they're antibiotic resistant. Fungal infections are, if they're on the skin, they may be able to be treated topically. If they get internal in the lungs, etc., it's rough. Fungal infections are rough. And then we still do have pathogenic animals, bugs, worms living on us and in us. And some of that is symbiotic, especially with bacteria, but some of it is not. And so the ones that we encounter on the skin would be scabies, lice. Ringworm is more of a fungal type infection. So they do have a medication. It's a parasitic based medication that can be used for dealing with pathogenic animals. So intact skin becomes really important with this. Disease prevention and control is how we try to keep these from getting inside or on us. And if they do get inside us and on us, that our immune system response can clear that from our body. How we come in contact is environmental, opportunistic, and person to person. So this is what we try to control for sanitation. So the CDC, Centers for Disease Control, have developed standard precautions just regardless of what this is, and transmission-based precautions, especially they've got a set for respiratory. So when we cough and sneeze and spit and whatever our mucus, our blood, our fluids gets out of us and into the environment, that is a common source of transmission. So we got contact precautions, droplet precautions, and airborne precautions. Now remember, this is all important, every bit of it. How we try to control that is aseptic technique and an infection control plan. So here are some here is some information on what the chain of infection is. And then an infection control plan tries to intervene somewhere. So a pathogen must be present in sufficient numbers to cause infection. So when we disinfect, when we clean, when we disinfect, when we sanitize, those are different things. We're trying to reduce the numbers of the pathogens. Sometimes what we are trying to mitigate is a source host. So this might have something to do with like getting bitten by a mosquito. So the mosquito is the host, and then it bites us, and then it's in us, and then it is spread through a cough or a sneeze or contaminated hands or on surfaces. And the pathogen has to get in. So that's where the integrity of the skin is so important, and how a prevention control measures to cover the holes that go inside our body, particularly our nose and mouth, but also other mucous membranes. And then we also have to be susceptible to that pathogen. If a person has had a prior exposure, they've had the condition, now their immune system's trained, it knows what to do. That is a way of preventing disease. Or if there has been a vaccination, which is a controlled exposure. That's what a vaccination is, a controlled exposure. So you can get the flu and be then probably immune to that same strain of the flu. You can get another strain, but you're probably not going to get that same one. Your immune system has become educated. With a vaccination, it's very controlled. It's got a dose amount. It's enough to trigger the immune system to pay attention and educate the immune system. But because it's such a controlled exposure, there is a much less potential for the person to have a significant adverse effect. So during massage therapy, there are our face cradle, and things that clients would touch, and then particularly touch their face. That is those are our most risky transmission routes. So we got critical items, and we don't do these except if we use some of like a tool that we'll talk about in a future chapter. And it should happen to break the skin. Now it has become a critical item, and it has to be cleaned, and then it has to be disinfected. And there are germicides specifically that are sterilants, or it has to be heat treated. Semi-critical items only touch mucous membranes. Again, that's not something that we would specifically, we don't have a tool that would specifically use that. We don't look up into the nose and check and see what's going on in there. But mucus secretions can become in contact with the face cradle in particular. And then we've got our non-critical items, and these only contact intact skin. Pay attention to box 7.1. Important. Attention. Box 7.1. Cleaning, sanitizing, disinfecting. What is an antiseptic? How is bleach used? And bleach is probably remains the most effective way of managing virus, bacteria, fungus, and it's readily available and inexpensive. Now it's got drawbacks, but this is the go-to. And if another product is used, then you need to make sure you are using a product that will address all of these pathogens. So here's instructions on how to use a bleach. So 1 to 10 solution made up daily. And then here's a list of other disinfectants. Hand sanitizers are using alcohol-based. It has to be alcohol-based. And in all of these, there is a contact time that's necessary. So you put it on, you see that it's wet, you let it, not dripping, but it needs to be wet. It needs to have coverage, and it needs to dry on its own. So first, you clean the area that needs disinfecting. So cleaning is soap and water. Maybe a degreaser, like Dawn dish soap. And until it's free of stuff that you can see and feel when you touch the surface. Then you apply the disinfectant. Make sure it is covering and it looks like something has been applied. And then you need to let it stand till it dries on its own. All right. So here are disinfecting wipes and sprays, hand sanitizers, and then a caution on how to use these products safely. All right. And here are some links on staying up to date. So we're gonna narrow down here a little bit. We're gonna look at managing surfaces, and then what the CDC offers as far as procedures. This is a good mentoring tip. Read this one. Should I massage when I am sick? And then box 7.2 here. Important, pay attention. is going to give you points that are necessary for the facility. Okay. And then you also have to be very attentive to safety. So get rid of tripping hazards and make sure that the floors are not slippery and that there's adequate lighting and that you have a fire extinguisher that is in work condition and that you don't use flames in the area. How your equipment is managed, how you keep topical preparations, because our massage lubricant, for example, how do we keep that from being contaminated? How are the linens that we use maintained? And then we always practice, just as a general rule, communicable disease prevention. So indications specifically for standard precautions for massage therapists. We don't have the same risk of exposure as in the medical environment, where body fluids are commonly, people vomit or they bleed, and there could be an incontinence issue, and that's just a real, medical settings are just a real pool of where pathogens like to hang out, because they're more apt to be able to, they're trying to live too. So they're trying to pass through their own life cycle. So there are things that you might see in a medical environment that's done routinely that we may not do as much, such as wearing gloves. You want to make sure that you practice doing massage wearing gloves. If the glove is tight fitting, the client really doesn't feel it. And if you have any breaks in your own skin, like a hangnail, or you've got a cut on your hand or something, you need to cover that. We also need to not fight the use of a mask. Masks protect us, and they also protect others. So here are your standard precautions and transmission-based precautions. Pay attention. Personal hygiene practices, including hand hygiene and cough etiquette. Cover a cough into your elbow. What is aseptic technique? How do we use personal protective equipment? And what we would do here, standard precautions must be used if it is likely you will come in contact with any of the following. Transmission-based contact often refers to the specific setting. So we've got contact precautions, droplet precautions, and airborne precautions. So we have to be aware, we have to have an ongoing surveillance almost of identifying potentially infectious individuals. And that includes skin pathologies or something like even poison ivy, which it's not highly transmittable from person to person, but it does stay, it's an oil. So it does stay on the skin or on clothing. If somebody when you're doing your reminder calls in the future, you want to remind somebody if they have symptoms of an infection to please reschedule. We've already questioned, should I work if I am sick? So there's a difference between not feeling well with like a sinus, a seasonal sinus. We can cover our mouth and nose with a mask, and we can up the sanitation, but seasonal allergies are not transmitted, they're not contagious. But sometimes we don't know. We don't know if we've got a cold or a seasonal allergy. You have to stop and consider what you're going to do about a cancellation policy here. And you may have to also cancel clients. So these apply to these specific conditions. So exposure to fluid and rashes. So individuals need to be referred and refuse treatment until the condition resolves. And that's hard to do, but safety first, safety first. And then always, always perform hand hygiene all the way up to the forearms. And if you are using a method that uses some other part of the body, usually the feet, that has to be handled and managed just like hand hygiene. And you do that before you wear your gloves, if that is indicated. Here are the recommendations about personal protective equipment and the sequence of how to use them. Talked about that, when to wear a mask, possibly indicating that a client needs to wear a mask. You have to have a procedure to clean and disinfect the area. And these are just 3 of the conditions that we need to be specifically aware of. And if a client is referred for diagnosis, then this is what you do. Here are your specific hand washing sequence. What to do about gloves, masks, eye protection, face shields, gowns, protective apparel. You need to know this. You need to know this so that you are acting professionally, but you will also have at least some test questions on this on the NBLEX. So, required use of standard and transmission-based precautions. The fancy words for this is to don and to put on, and to doff, to remove. Key points related to personal protective equipment. Probably are going to want to use nitrile-based gloves, not latex. Vinyl, the problem with vinyl is that it's hard to get a snug fit with vinyl. Gowns or smocks are sometimes indicated. That's easier. They can be easily laundered. You don't have to change your whole uniform if you put on a fresh smock or an apron. You're going to want to practice donning and doffing gloves and taking off how you roll remove in a manner that protects you from getting the outside of the garment on your skin. And then roll the outside of it so that the contaminated area becomes contained. More information about a face mask and what to do if you do become exposed to a contaminant or a body fluid. Then we get into specific cleanup procedures. This is after an exposure and in between each client, because whether they got anything or not, that's considered an exposure. So here are your cleaning and disinfecting agents. Here are recommendations about environmental cleaning from the CDC. Here are specific recommendations for massage therapists. We're considered low exposure or intermediate. So a lot of what we do as far as cleaning is concerned is soap and water. And then again, the most reliable disinfectant is the bleach solution. Step by step on how to clean. Products, sterilizers, disinfectants. We don't typically use sterilants in the massage environment. We use disinfectants and sanitizers. Step by step on hand hygiene. Step by step on respiratory hygiene and cough etiquette. And then a section here on preventing the transmission of contagious conditions. So we're talking specifically here about the human immunodeficiency virus, HIV and AIDS. That is not as critical. I mean, you always follow standard precautions. So if you follow standard precautions always, then you are protecting yourself and the client from this. But more common are the hepatitis A, B, C, D, and E. Hepatitis A and E are spread through contaminated food, water, and human waste. B and C are the ones that are more transmittable from person to person. So we've all lived through the pandemic. Coronaviruses are common. The COVID-19 virus, SARS-CoV-2, has evolved and evolved and evolved. It is a virus which is harder to manage than a bacteria in terms of disinfection, but it is gotten by bleach or disinfecting, commercial-based disinfecting products, not essential oils. So the droplet transmission, the airborne transmission, as well as contact transmission, and the most concerning is airborne, where these droplets are tiny and then they just stay floating around, and when you breathe in, they come in contact with the inside of your body through your mucous membranes. Norovirus is common. It is what commonly is called the stomach flu, but it isn't a flu. It's spread easily, and it shows if one person's got it, other people are going to get it. and you can have a carrier. Some people don't even know. So you've heard about cruise ships and schools and long-term care facilities where the norovirus has really caused havoc. Then we got C. diff. This is a uh, uh, antibiotic resistant intestinal, uh, it's a terrible condition that overgrows and again is the intestinal tract, and it is highly contagious, and they're having difficulty with this because of overuse of antibiotics. So here are the risk factors, and here are the symptoms, and C. diff is hard to treat. So prevention, prevention, prevention. Tuberculosis is more common than people want to think. And then we've got these multi-drug resistant organisms. And I've mentioned that 2 or 3 times where they just don't, the antibiotics that we have are just resistant to the current treatments that we've got. This becomes really an issue with immune suppressed individuals. We just have to be extra, extra, extra cautious. This is the fungal diseases. They're different, they're difficult to treat. The antifungals are, but standard precautions and being cautious about transmission will keep you protected here. And then we got MRSA, and that is a staph infection that is, it can be local, and it will look really angry. Of course, this is going to be an indication for referral, and also a wide berth around it if it's a local condition, like it's a boil or an infectious cut. You're gonna make sure that the person is getting that treated effectively. You can massage in the non-infected areas, but remember, if there is any accompanying fever, if the person is has a lot of pain, this can go into sepsis, and then the person can go downhill very quickly. All right. Important, important, important. This is the world we live in. You can't avoid this. You can't let this make you afraid. You want to be intelligent, and you want to be consistent and persistent. Keep yourself healthy and keep your skin intact. All right. So premise and fire safety are both for the massage therapist as well as clients. So we've got workplace safety. This has to do with making sure there aren't any tripping hazards, there aren't any fire hazards, there isn't anything that is going to cause an allergic reaction, there isn't something that's going to fall off. And so OSHA, the Occupational Safety and Health Administration, does a lot of work around a safe work environment. So here's a checklist that you can use, and you could get a question. Let me see if I can come up with an example. A client tripped in the restroom, what would be the most likely safety hazard? And then it's probably not going to be caution signs. It's probably not going to be a stairway, but it could be spilled material. So got to make sure all your exits are clearly marked. If you've got any steps, you need to get caution signs there. Lots of times in a facility where massage is performed, you'll have the local safety officials come in and do an inspection, especially with fire safety. So make sure that you're maintaining an environment that doesn't have things that are going to ignite. And one of the things that will ignite, you got to watch with your laundry, is your dryer. And even with the best laundering, if you're using an oil for your massage lubricant, it is combustible and it doesn't always totally wash out. So you got to watch your dryer. Don't overload your dryer. And then the other thing is especially the alcohol-based sanitizers, that is also flammable. So you want to keep flames out of the environment. You also need to have a fire escape plan, and you need to have fire exits clearly marked. So here's a good proficiency exercise to kind of expand your understanding about why these measures are in place. We also have equipment in the work environment, so we have to be aware of those, and we have to make sure that storage areas are not blocked, that things aren't going to fall, that there's a fire hazard there. And then here are some safety measures specific to massage therapy. Never use candles, incense, or an open flame. Be cautious of live plants as a decoration because some are poisonous. Be careful about using heat on clients, especially the hot stone. Always have a barrier, a towel between a hot application. Make sure that the table is sturdy. Make sure that you are following all sanitation and infection control. Avoid nut-based products for all lubricant, because that is sufficient for some people who are susceptible to have an allergic reaction. Don't leave kids unattended. People in the last trimester of pregnancy and others that are unsteady on their feet probably shouldn't be left in the massage room alone. You don't necessarily lift them on and off the table, but you need to be present and provide, support so that they are not going to hurt themselves because they don't have good balance. Make sure that especially if you use oil, make sure that the place where the person is going to put their feet is not slippery, and because that can be a slipping hazard. Okay. Really, really pay attention to falls, including in your external areas like your parking lot. Make sure that everything is barrier free. Avoid using throw rugs or anything that will tangle around the client's feet. And be very cautious of people walking around barefoot on, especially on a hard floor, because they'll slip. You should always provide a robe and slippers if the person has to get up off the table to use the restroom. If something does occur, you want to have an incident and accident report. And again, it says be careful but not fearful. A confident demeanor combined with professional etiquette prevents most misunderstandings. So ergonomics considerations has to do more with you, the massage therapist, body mechanics, the type of shoes you wear. This is specifically discussed in chapter 8. So this is how you take care of yourself. And it would be an issue on whether you decide to work in a particular environment or not. How well does the employer attend to these issues? Unfortunately, in our society right now, we do have to have an awareness of workplace violence, whether it is happening amongst the staff or it is a client that becomes violent or might be displaying violent tendencies. We can't predict human behavior, but this is a situation where in the very beginning where you work, if you are employed, you want to be certain that your employer has a good working relationship with local law enforcement. If you are your own employer, meaning you're self-employed, you need to have a good working relationship with local law enforcement. So here are some signals that you can look for. We had at the wellness spa with the school, we had people that we had to have removed by the police where they were irate over our policies during the pandemic about wearing a mask. And what are you going to do? And so you just have to be prepared for that. So if you think somebody is going to become violent, then, don't wait until a terrible thing happens. So also be cautious and aware of potential for workplace assault. And parking lot is common. If you are in an employment situation, you should not be left alone in the environment. There should always be at least 2 people. If you are self-employed, you need to be aware of late night business hours or going into a poorly lit parking area by yourself, or not having the doorway secured so somebody could walk in. So I am really, 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 really anti-bullying. And I was bullied as a kid. And so I am really anti-bullying. And this is a form of harassment, and it shows up very insidious. It's very insidious. Gossiping about somebody, talking behind somebody's back. Those are also forms of bullying. Don't do that. So there should be a zero tolerance policy to that, and you shouldn't let clients bully you either. No bullies. You don't bully and they don't bully either. Now, that's not the same as assertive. You absolutely need to be assertive, appropriately assertive. But there's a line where that becomes bullying, especially when your assertive process is targeting one particular person over and over. So be prepared and prevent this. Forewarned is aware. And it's important to have an emergency plan. And one of them is to have a pre-thought out safe area, safe room. And you can actually have a emergency kit available, and everybody should know what to do. So here is the Department of Homeland Security. They have a lot more information, and specifically this is for an active shooter. So here are the bullet points that you need to be aware of there. And then when violence does occur, it is there is a process of how you respond and absorb that. So stage one is survival. And then stage two is we start to realize what had happened. And then in stage three, the victim tries to make sense of the whole thing and then get back into a way of functioning outside of that traumatic event. And in a previous chapter, we talked about trauma-informed care and the long-term effects of trauma and post-traumatic stress disorder. Sexual harassment happens across the board, but we do have to be extra attentive to this as massage therapists because of the unfortunate and horrific connection of the massage parlor, the illicit sexual business that is almost always organized crime involved and with human trafficking. So, so we have to have an increased attention to this because the general public is confused. Not all of them. I mean, we're making really good progress in getting the word out there that therapeutic massage is non-sexual, but it's still there. So here are some parameters around sexual harassment. And it can creep up. A person can be groomed. So, and you don't ignore. You've got to be assertive around this. So it's a broad spectrum of conduct, including gender transition, commenting on gender identity, sexual orientation. It also includes unwelcome sexual advances, requests for sexual favors, verbal or physical conduct of a sexual nature. And here are the bullet points to take a look at here. So anybody can be vulnerable to sexual harassment. And I want to point out here that women also can be harassers, and that we sometimes forget that. And male massage therapists are really vulnerable to a little bit of a double standard there, where if if a female client has harassed them, um, it they can say, the client can say, oh, no, 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 it went the other way. It was inappropriate behavior by the male massage therapist. They are more vulnerable. So they have to be even more meticulous about their conduct, and to not in any way um, act as if there is any form of sexual innuendo. So, and if a male massage therapist is sexually harassed by anybody, they should respond by leaving the room right away and then filing a police report. So here are your bullet points here, and how you would document these instances. So this box is really, really important, and you've been exposed to this in some of the charting and documentation we use here at Health Enrichment Center. But you have to be, unfortunately, upfront right now at the very beginning, have a no tolerance policy. You can copy and use this. And then, because if there is actual litigation that might occur, you need that documentation in place so that you are able to provide the correct information to law enforcement. And then this is what you should do if you're harassed by a client. If you're by yourself and not in a group environment, then this is what you would do. Leave the room, go to a safe room, or leave the facility and call 911. Solicitation for sexual services is a crime. And then here are some prevention suggestions. Don't try to ignore the problem. Be right up front with the problem. And then we have to behave appropriately as well. And we have to have a deep, abiding respect for our clients. And we have to understand that they might also be confused about the touch. That's why things like draping are being crisp with your draping is so important. Don't lock the external door. This gets tricky now. If you are self-employed in a small office, you don't want people just walking in. But usually there is an entry, not always, but usually there is an entry, and then there is a designated massage area. And so you would, if you're by yourself for safety reasons, you would lock that door that goes to the outside, but don't lock the door where the actual massage is occurring. Clearly inform clients of your policies. Require clients to wear undergarments that cover the pelvic and buttock region. And that just sends a message when you do that. And if you are working in that area, and not in the pelvic area, but around the hip and into the lumbar area, you can, with permission, you can, and you want skin, with permission, you can move the undergarment using the sheet touch the undergarment with the sheet and move it, or you can have the client move it. But you only move it enough so that you can get to your target area around the hip or as the lumbar area comes in to the gluteal region. Use additional draping to make sure that the breast tissue is not touched. And you can roll a towel and have the person lay on that. And also be cautious as you are walking around the table, your groin area is right about table height. And so make sure that the client's arms and hands are not, you're not brushing up against those during the massage. You can tuck them up under, or you can wrap a sheet around them. And this happens most commonly in the prone position. Don't lean over the client so that the chest area is in their face, or and that's not good body mechanics anyway. So this is that point. Make sure the client's hands are tucked under their body so that they don't inadvertently or purposefully touch you. So don't make any exceptions to these rules. If a client makes a sexual advance, even minor innuendo, it's done. That's the only way that we are going to consistently stop this. Leave the room immediately and report the incident to the front desk. And then if there isn't front desk available, you can leave a note and then you leave the environment. If it was direct solicitation, or you were uncomfortable at all, or you felt harassed, call the police. Don't hesitate. That's why you want to have a good working relationship with your local police, so they understand that if there is a call, what the priority is. And in a situation, even if there are not circumstances where the police can make a direct arrest, for example, or charge, at least there is a police report made, and it starts a file on the person. So always report. So here is another box where we talk about how the massage therapist is expected to act and how the client is expected to act. You can copy this verbatim and use it as part of your brochure, your website, and your initial discussion, your initial intake with clients. You can post this so that it's right where people can understand it. You can post this in the restroom. You can post it at the front desk, and then it's right in front where people know what's going on. And then what happens when there are unfounded accusations? This mostly happens to the male massage therapist. So that's why I step back here and have a specific section for that. And finally, woo, what a discussion, right? Finally, we get our foot in the door. This is kind of a funny one that says, so make sure that you're wearing a non-skid shoe so that you don't slip. And here's your summary. Learn more on the web. Your Evolve site has your chapter tests, remember. They're long. Your chapter tests that are required to go into your grade book are long. And so the rest of this information that is available is excellent, excellent study support. And the multiple choice questions for discussion and review with the answers and rationales also are on the Evolve site for you. Ah,